Hello, my name is Jade and we will be looking at the non-pharmaceutical approaches to managing dementia through the use of a case study. Firstly, I'd like to discuss the various behavioural and psychological symptoms of dementia, which is also known as BPSD. Now, BPSD is a term that's used to describe the various types of symptoms that may arise due to dementia and can range from things like anxiety, depression, irritability, and hallucinations. There's also others on the table there you can view if you like. Now, those symptoms can often be distressing and at times can be difficult to manage. Fortunately, though, there are solutions. One route is the pharmacological route, which includes using pharmaceutical drugs to help manage the symptoms of dementia. However, before we get to that point, there's also non-pharmaceutical solutions that may be used as well, and they can include things like memory training, pet therapy, aromatherapy, exercise, and many others. And that's the goal is to use those first before a pharmaceutical approach. In order to place PTSD into some sort of context, we have a case study. Now, we have Fred, who is aged 78 years of age, and he's currently in an aged care facility, having been there for 11 months after there was concerns raised about his safety. Now, initially Fred had no issues with being in the home and receiving assistance with his hygiene needs, but recently that's changed, with there being agitation and aggression towards the carers who were trying to help him. Now, it was recommended that Fred try a small dose of Quetiapine to try and manage those behaviours and to alleviate any issues with care needs being met. But after 2 weeks of being on Quetiapine, Fred, while being less resistive to his care needs being met, is also more sleepy, and he's considered to have slurred speech, and he's not eating as much, and that's raising concerns for his family. Now, there are alternatives, and one that we are going to look at is music therapy. However, before looking at music therapy, we will be looking at Quetiapine, which is the drug that Fred has been prescribed for his agitation and aggression. Quetiapine is a second-generation antipsychotic drug that is traditionally used for anxiety. However, for Fred and others with BPSD, it's being used off-label as the intended use for anxiety is not what it's being used for. It is important to note at this stage that Quetiapine has not been proven safe for those that are aged or with dementia, so that needs to be taken into consideration when looking at alternatives to manage Fred and others' BPSD. Looking now at a study that focuses on personalised music for treating BPSD, we can see that there's been a study of approximately 35 different residents and their families with a steady rate of 20. The study was run for 8 months with weekly meetings with medication technicians overseeing the whole process. The process involved music being placed on iPod shuffles for residents, with residents' needs taken into considerations as well as their likes and dislikes. Over the course of the 8 months, the response to the music was recorded by the medication technicians on a 3-tier rating scale for mood and the changes in the mood that existed. In the end, the tier ratings were analysed and looked at for the number of residents that participated, the change in mood, the staff participation, the key delivery costs, and the elements of that, and the cost to maintain the program, such as maintenance of iPods and replacement. Considering now the results of the study, we can see that 70% of the people that were involved in the study had normal behaviours and emotions, which is actually a really good thing because it shows that there is some benefit and that there's no adverse effects. However, in saying this, 11% of the people in the study were anxious or agitated, and 9% were depressed and withdrawn. Now, those changes to behaviour may be reduced again and become more normalised if music is targeted more towards the individual needs of the resident, but it can be hard to say. And it's also hard to say when we have 10% of the people involved in the study refusing, because that skews the final results of the study as well. However, the final results of the study were actually quite good. There was a 62% improvement, a 4% worsening, and 34% no change. The study has shown that there is some benefit for music therapy in controlling PTSD, so that's really good. It's also been shown to improve quality of life for both the resident and the carers. However, in saying this, the positive effects of music therapy that's been personalised is only possible when it's been consistently repeated and not left to go by the wayside. Finally, we need to look at what solution is best for Fred and his situation. Now, Fred, from the case study we've seen, has been given a prescription for Quetiapine after an outburst of aggression and agitation towards a carer who was trying to get him ready in the morning. Now, if we consider that and consider Fred as an individual, we can see that prescribing the Quetiapine is not the best solution. In this case, the best solution would be first to provide a non-pharmacological approach. In this case, we've looked at music. Now, this is a good alternative because there's no adverse effects like nausea or sleepiness, which is the case with Quetiapine, and there's no other issues that can make Fred have a less quality life. So we need to look at that as the best option. Now, if Fred was to change and have more aggression regularly, then we might need to look at another non-pharmacological approach and have the Quetiapine as a last resort for agitation, aggression, or whatever else he may have.